Good morning. I'm Bob Sanborn, President and CEO of Children at Risk. We're a statewide advocacy and research organization. And today we're going to talk about birth rates in Texas, how they've been falling, and how do we address this. And this is a big national topic, so we have a number of experts here to talk about this. On the group with us is Christine Thomas. She is the director of the Center for Social Measurement and Evaluation at Children at Risk. She's out of San Antonio. Thanks for being here, Christine. Also with us from Fort Worth, the Associate Director of Early Childhood Education at Children at Risk, Lynn Lucas, is with us. And then we have a couple of fellows, policy fellows, that are with us for the summer from UT Austin. Mariana Nino de Rivera is with us, and we'll do some English and Spanish. Para la prensa latino, vamos a hablar español también. And then also finally from the LBJ School at UT, Kayla Foley is with us, a policy fellow out of Austin. And so we're excited to talk about this because there's a lot of talk in our country about declining birth rates and what we should do, if anything, to try to address this. Should we really try to figure out how do we increase birth rates? How do we make sure that our economy doesn't suffer because of a declining population? What's important to remember is that this is happening all over the world, and a lot of countries, most countries, it's happening much before us. So we've seen Japan's aging population and the impact that that has had. We see this happening all over Europe, where the birth rate is not at a replacement level. And so these countries have tried very hard, all sorts of different policy things to try to reverse a declining birth rate. And a lot of times economists associate a declining birth rate with a potential fall in economic output. But I think a lot of people also associate this with this idea that as we grow older, who's going to take care of us if there's not sort of a vibrant workforce, a workforce that's producing? And so this becomes sort of an interesting question for us. And we're thinking about it now because the current administration has talked a lot about this declining birth rate and what they should do to address it. So we've put our heads together, we've looked at the research, and we're very interested in this. And when we look at the data here in Texas, one of the things that we see is that in Texas, specifically in Texas, the birth rate has fallen by about 21% between 2007 and right before the pandemic. So a real sharp drop, sharper than the national trend. When we look nationally, the birth rate right now is about 1.6 children per woman. And the natural replacement rate, and we'll talk about that in a little bit with Christine, is about 2.0. And so we want to see, so that means we have this declining birth rate. Our population in the United States is about 347 million. Projections are that that will grow slowly. By the 2050s, it'll be about 380 million. So a very slow growth. But it's by the year about 2033 or in the mid 30s that we see that deaths will start to surpass births. And of course, some of this continued growth is because of immigration, and so that's also part of the equation in the United States. Interestingly, the rest of the world used to not worry about the USA because we felt that our rates would continue to be high because we had this robust immigration that doesn't seem to be part of our current strategy. So, what is the answer to all of this? We'll talk about this today, but there have been a lot of shoot from the hip answers all across the world. Medals for moms, extra one-time stipend for every birth, larger standalone child tax credits. There have even been patriotic campaigns, like do this for our country. And none of these really seem to work because they're not sort of comprehensive. They're not focusing on the real needs of women and dads in our workplace and families overall. Interestingly, recent polls show that young families do want to have kids, but really they don't want some of the hurdles and the financial and lifestyle hardships that come with having children. So let's face it, because the way that our culture works in the United States, and certainly in Texas, is that if you're the least bit ambitious in your career, having children often doesn't fit into that equation. Because if you're career ambitious, we reward status based upon how you're doing in your career. It doesn't really help you if you have kids. We're looking at how successful you are on your career. So the questions become, can I afford childcare? Does it afford me time, or is it just going to hamper my career? And will I lose my job if I take time off? So we're trying to address some of those things as we create sort of a model for family growth. So as we look at this model, as we consult the evidence and talk to experts, we've come up with what is really a Texas model for family growth. So when we look at the Texas model for family growth, four key things sort of come to mind for us. Is sort of these are evidence-based and they've worked in certain countries. And if we could sort of translate them into a Texas climate, there's some possibilities here. One is pretty simply affordable, high quality childcare. If we have good childcare and if it's quality, parents are much more likely to think, well, at least my kids are being taken care of while I work and things are going to be okay. If we really followed the evidence on this, this affordable, high quality childcare would be universally free in Texas, but we're probably not there yet. But I think this idea of having affordable, high quality childcare for everybody is really something that's really important. The second part of the Texas model is a family focused healthcare system. So if we're investing in early childhood and maternal health, so the health of those kids, those infants, and the health of moms, we're going to reduce long term medical costs and remove potential future uncompensated care. So, again, can we have free healthcare for moms and infants? It'd probably be important to move in that direction so people don't feel like there's going to be any financial burden into having their children. I think the other thing that really seems to work well in countries and other countries, and this is our third piece, is family growth focused parental leave. So interestingly, only one other country in the entire world does not have government funded paid parental leave. Papua New Guinea, not exactly a model for policy in our world. But more importantly, every single country that has seen an uptick in the birth rate has had a very generous program of paid parental leave, federally funded paid parental leave for both moms and dads in most cases. And the developmental benefits are amazing, right? For a mom and dad to be able to spend high quality time with their kids in the early years is invaluable. It's something we don't do a lot of in the United States with people going back to work after 6 or 8 weeks. But we think that if we can do something like this, we find that parents really love this idea. And the other thing is that they're guaranteed that job when they return to work. So this is another thing that countries do is they guarantee the job. So again, your career doesn't seem to have a detrimental impact when you have kids. So the benefits of having kids are there, but the success of keeping that hard-earned career is really there as well. Now, the fourth part of this is something that's maybe a little bit more controversial, and that's looking at the reality of immigration. One of the realities in Texas is that we do have immigrants, and by and large, the vast majority of those immigrants are documented. They're completely legal. And when we look at children, we're talking close to 90% of all the kids that are immigrant kids in Texas are documented. They're here, by law. And so if we face that reality that we have immigrant children, I think it's important to think about what if we really had a well thought out immigration policy in the United States? What if we aim to change our current immigration policy and think it through, like figure out what really works for us and how it helps us address this birth rate decline? So if we'd have to put politics aside, we'd have to figure out what works and really understand that people do want to come to this country to contribute and understand that people do want to raise families here. So if we're thoughtful, which sometimes is a far reach for us. This can be another part of family growth strategies. Texas has always been on the front lines of immigration. We can make that a positive thing for Texas and its economy. And so we have included it as part of the Texas model, even though it can be controversial. I'll finish by saying that I was in Washington, D.C. last week to visit with the Texas delegation around challenges facing young families and children. And the political climate is really not good right now in terms of agreeing around families. This is not a political environment that makes families want to have kids. In Texas, 65% of our children are growing up in lower income families. And this is not working in the right direction in terms of our political climate. I know that in Texas, we believe in families. We love our families, no matter what side of the political aisle you sit on. But we need to work together because if we're making healthcare more difficult, we're making ends meet more difficult, we're cutting food programs, we're making Head Start more difficult for families. a lot of subsidies that really help families are going by the wayside. So we need to work together and create policies that work for families, that really work for economic growth, and those that really keep our economy humming. And that's all about kids. That's all about these young families. We have so much potential as a state in Texas, but we have to be thoughtful about this. And so, all of these things, as part of this Texas model, are things that we hope that in the future we all consider. It's something we should really be talking about. So, we have some great panelists here today. Let's start with Christine. Christine Thomas is the director of the Center for Social Measurement and Evaluation. She's out in San Antonio. Christine, I know that you want to focus on some of the data. Give us some idea of what we're talking about here.
Thank you, and good morning, everyone, for joining us. So today we're going to talk about the critical demographic shift that's shaping the future of our communities, our workforce, our economy, and it's the continuous decline in birth rates across the United States and here in Texas. So nationally, we see that the birth rate stands at 12 births for every 1,000 children, or 1,000 people, sorry. Declining every year. This is not let up. There's some people that are going to say, but Christine, the total number of births have increased in 2024. We see that going up. Yes, but the general fertility rate has declined. So what does that mean? You mentioned earlier, Dr. Bob, that the replacement level is below 2.1. What does that mean? So replacement level fertility refers to the average number of children that a couple might have to replace themselves, right? So we see typically two. Sadly, we do have to take into account child mortality. So that's the actual required rate needed to replace someone. So in countries like US and Texas, child mortality is low. So we have that replacement level of 2.1 to ensure that replacement sustain, not a growth, right? So if we want our population to grow, that needs to go up. So in contrast, other countries that need, 3 or 4 children to account for higher infant mortality, it's the reality. So again, over time, populations at or below will eventually see decline in size. So when we think about Texas, everything's bigger in Texas. Texas is the second largest state in the US. We see compared to the national average 55 births for every 1,000 people aged 15 to 44. So that's about 40,000 births recorded in 2023. So that's a lot of kids, but even in Texas, we're seeing this shift in maternal age. So the age that women decide to have children is later, meaning they have less children, 1 or 2, declining teen birth rates, which we're so proud of, right? We know that's a concept that Texas has been working on for quite a while. Just changing patterns around racial and ethnic groups. So what are the themes driving this decline? And Dr. Bobby mentioned a lot: economic pressures, rising housing costs, childcare expenses, healthcare costs are really reshaping that family decision. For family planning decision, cultural shifts, so career opportunities, personal decisions, those are leading to delay or even forego parenthood. I don't want to say it, uncertainty and anxiety. We have concerns about climate change, political uncertainty, economic volat. So economically, we're not stable. So that influences our long-term life planning. So why do we care about the birth rate here in Texas in the United States? So Dr. Bobby mentioned aging population. Those fewer births mean there's that base is shrinking. So young workers aren't going to be able to support the expanding older population. The healthcare needs are currently under pressure, right? We don't have enough doctors or pediatricians for children. So when we think about the aging population, we don't have enough nurses or med techs or things like that. It's continuous need in Texas. That goes into the labor force challenges. As workforce participation declines, we're going to see those key sectors really looking for that demand. So education, obviously children at risk is following that, and we'll talk a little bit about that later. Healthcare and that infrastructure within the government. So policy strains, our social safety nets, Medicare, Social Security, are going to face challenges. And then our community impact, thinking about how many schools closed over the last few years. School enrollment have dropped, rural depopulation, communities are going to drastically change with the shift in demand for services and reshape how we allocate any resources and as people are planning for the future. So this isn't a trend. It's not, a fad. This is an ongoing pattern that has happened over the last 10, 15 years. So this is a call to reimagine how we can support families, invest in our own communities, and plan for generational sustainability. So whether policy intervention, economic reform, or cultural dialogue, we need to respond to support families in Texas.
Very good, Christine. Thank you very, very much. Love hearing all the data. It's out there, right? I mean, this is something that we start with is what does the evidence show? One of the big things that the evidence shows is the importance of childcare in regards to parents feeling comfortable having kids. Lynn Lucas is with us from Fort Worth. She's the Associate Director of Early Childhood Education at Children at Risk. Lynn, give us an idea of what it would mean if we had high quality early education for everyone.
Good morning. In so many ways, Dr. Bob, the future of our state is in the hands of our families. So let's consider an investment that's foundational to our prosperity, our economy, and the well-being of every Texan. And I'm not being hyperbolic when I say early childhood education. Now, today's families face a dilemma that previous generations just didn't to the same degree. As a mobile society, fewer families have the support of nearby extended family. So when a parent needs to be a dependable employee, they need a dependable system of support for childcare. We're asking families to make a choice that often feels at odds with itself. So pursue a career and build a family. We need more people in the workforce, and childcare is exorbitantly expensive. And this isn't just a theoretical problem. In Texas, for a family, the cost of childcare is anywhere between 10 and 50% of their annual income. It's a staggering burden that makes family growth a choice that many people understandably feel they can't afford. So the consequences are visible all around us. There's a workforce shortage. There's also a childcare shortage. When the childcare shortage is 3 times as great as the shortage is 3 times as great as the supply is less than the need. We call this a childcare desert. And so in Texas, we have 2.3 million children under the age of 6. 20% of our zip codes of all of Texas are childcare deserts, where the need is 3 times greater than the supply of childcare. This problem is even larger for low-income families, with that number jumping up to 40%. A childcare desert is not just an inconvenience. This can be a profound barrier to family success and an actual deterrent to family growth. It ends up being like this invisible wall that prevents parents from joining the workforce and the workforce from becoming parents. It's scientific, the stakes are high. We know that 80% of child growth and development in the brain occurs by age 3. So the early years aren't just a phase. It's the most critical time for building the foundation of a lifetime of learning and success. And whether those quality experiences come from a parent staying at home or from a dedicated teacher in a childcare setting, this makes quality early learning the absolute highest return on investment that we can make. We know based on loads of research that for every dollar spent, the return on investment is anywhere between $4 and $16. So it's not just about having a babysitting service, it's about leveraging the size of the opportunity alongside the size of the investment. There's a lot of talk about the cost of these policies. It is expensive, but the far greater cost is one of inaction. The bottom line is that investments in pro-family supports like accessible, affordable childcare and family leave are not just expenses. They're a foundational investment in our most valuable resource, our human capital, our economy, and the very fabric and future of our state. And so, we'd like to see things that support our families, actions that support our families and empower our workforce, and ensure that having a child isn't a source of financial stress, but a source of joy and a path to a brighter future for all of us in Texas.
Lynn Lucas up in Fort Worth. Thank you, Lynn, very much for the work that you do and for those comments. Let's go to Mariana Nino de Rivera. and we're going to speak in both English and Spanish with Mariana. Mariana, first in English, give us an idea of outside of early education, what other barriers are there, or what other things should we consider when it comes to supporting families?
Yeah, thank you, Dr. Baum, for that question. So we see that access to healthcare also remains a pressing issue for Texas's families. We know that access to regular prenatal care is essential to ensure healthy pregnancies, but limited access to healthcare before and during pregnancies puts women at greater risk for adverse health outcomes like preterm births, infant mortality, even maternal death. Maternal mortality in Texas actually rose by 56% between 2019 and 2022, far outpacing the national increase of just 11% during that same period. So this really does underscore the need for accessible, affordable care. In fact, 1/3 of low-income women of childbearing age in Texas lack health insurance, which is more than twice the national average of 21%. And those living in poverty are disproportionately affected by this lack of coverage, which puts them and their children at greater risk for poor health outcomes. And the impact of inadequate health insurance isn't just limited to pregnant women, but also to children under the age of 18. In fact, Texas is among the worst states for children's health care coverage. And while health insurance helps families afford medical care and supports healthy child development, too many children remain uninsured. About half of Texas's uninsured children are eligible for federal programs such as Medicaid or CHIP, but they are not enrolled. So meaning that they could have access to affordable care, but are missing out on these benefits. Addressing these healthcare gaps is essential to improving maternal and child health outcomes and ensuring a healthier future for Texas's families. If we want to support families' decision to grow, we must ensure that Texas mothers and children can thrive in safe, healthy environments, starting with accessible healthcare. And now for a Spanish translation.
Mariano, quiero hacerte un poco. Para la prensa latino vamos a hablar un poco en español. Sabemos que cuando hablamos de nuestros niños, de nuestras familias, es una cosa muy importante para nuestras familias latinos. ¿Nos puede hablar en español un poco de qué estabas hablando en inglés?
Sí, por seguro, Dr. Bob. Quiero empezar con la atención médica. El acceso a la atención médica sigue siendo un problema urgente para las familias de Texas, especialmente las mujeres embarazadas y los niños. Sabemos que el acceso al cuidado prenatal es esencial para garantizar embarazos saludables, pero el acceso limitado a servicios médicos antes y durante el embarazo pone a las mujeres en riesgo de complicaciones médicas. El estado de Texas ha visto un aumento en el número de mujeres falleciendo por el embarazo y el acceso a la atención. Y sin embargo, miramos que casi la mitad de las mujeres de bajos ingresos en edad fértil en Texas no tienen seguro médico. Por lo tanto, las personas con un nivel de pobreza tienen un menor porcentaje de acceso a una cobertura médica, lo cual pone en riesgo su salud y de sus hijos. Los menores de edad también cuentan con falta de cubierta médica. Texas continúa siendo uno de los estados del país con los niveles más bajos de cobertura médica infantil. Aunque el seguro médico ayuda a las familias a poder acceder un cuidado médica y apoyar el desarrollo de sus niños, demasiados menores en Texas siguen siendo sin aseguranza. Medios de los niños sin seguro médico en Texas son elegibles para programas federales como Medicaid o CHIP, pero no están inscritos, cual significa que muchos están perdiendo de estos beneficios críticos. Si queremos apoyar a las familias que quieren crecer en Texas, debemos garantizar que las madres y los niños puedan prosperar en entornos seguros y saludables, comenzando con el acceso a una atención médica accesible. Gracias, Dr. Bond.
Sí, es una cosa muy importante para la comunidad latino. Y cuando hablamos del Texas Model, estamos hablando de la educación temprano, estamos hablando de parental leave, estamos hablando también de inmigración en una manera civil. Tenemos que hablar sobre inmigración, lo que está pasando, porque esto es muy, muy importante si queremos arreglar lo que está pasando con los birth rates aquí en Texas. Finally, I want to go to Austin, and our fellow at the LBJ School, Kayla Foley, is with us. Kayla, I know you've worked on this, and I think one of the interesting things is that in Texas, we often really don't want to look to see what other models around the world have in store for us. But it's sort of interesting, right, to see that we've seen an uptick in birth rates in some of these countries. And while they're not at replacement, we've seen them sort of reverse. So, talk to us a little bit about some of the more interesting examples that you've seen internationally, Kayla.
Yeah, thank you, Dr. Bob. As we're thinking about how to support families here in Texas, we should absolutely be looking to global examples for inspiration. So firstly, we can look at France. France's fertility rate, around 1.8-ish, it stayed relatively high compared to other European countries. And that's for a few different reasons, but primarily they have stable and generous family policies that are built into everyday life, and they're not just temporary boosts like some of the proposals that I know have been floating around recently. They also have affordable childcare, which we've talked a lot about, and that starts for children at a very young age. And adding on to that, they have generous parental leave for both mothers and fathers. Sweden as well, they're a great example. They have policies that encourage parental leave for both parents. They have a certain number of days earmarked for both the father and the mother, and those parental leave days are use it or lose it. And that's been shown to increase the father's share of total parental leave.
To me, it was very interesting, Kayla. I went to Sweden and I visited around family birth rates and family leave specifically. And I remember the first time I heard about the generous family leave, I thought, well, this you can't do this. I mean, this seems like it's way too much. But the more you think about it and you think of that bonding time with the parent, you also think about the affordability of these young children staying at home compared to how expensive it is many times to keep babies in high quality childcare. It sort of evens out. But I think that developmental time seems to be very important. When you looked, Kayla, at some of these international examples, what are the barriers to them happening in Texas? And so I know I'm off script, but I wonder, could some of this stuff happen in Texas?
I would certainly like to see some of this stuff happen in Texas. But as you said earlier, the US is one of the only developed countries that doesn't have a paid parental leave requirement. So that seems like it could be an excellent first step. Research shows that 6 months of maternal and parental leave can support child development and strengthen maternal parental bonds, familial bonds. And it also removes all these potentially economic barriers that a lot of US and Texan families face. So mental health, children's outcomes, all of these are things that parental leave would really help address. However, as you said, there are plenty of things that Texas specifically needs to address before this can even be considered a solution.
Yeah, very good. Thank you, Kayla, very much. I want to thank all of our speakers today. Christine Thomas out of San Antonio, Lynn Lucas out of Fort Worth, Kayla and Mariana out of Austin. Thank you guys very, very much. And this is a topic which we're going to have a lot of discussion on over the next couple of years, I'm pretty sure. And it'd be nice if we could get ahead of the curve and start having a real plan for how Texas is going to deal with this. And so Children at Risk will be part of this. I'm Bob Sanborn. For all of us here, I'm at Children at Risk, and we hope that you consider this as a topic. Thank you very much. Have a great day.